The maximum benefits of these medications are observed when you are using lifestyle adjustments along with the medication. And there are so many benefits to diet and exercise that this medication will never replace.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
I'm your host, Neki Mohan. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're discussing a topic that affects many adults, weight loss. We'll explore the options, challenges, and factors to consider. And we're joined by Dr. Beatriz Jimenez-Cadilla, pharmacist at Baptist Health. Thank you for being here.
Absolutely. Thank you so much for having me here.
We're going to dive right in. Can you provide the overview of the latest advancements in weight loss medications and tell us about the different GLP-1 medications?
Absolutely. So GLP-1 receptor agonist, also known as glucagon-like peptide-1 receptor agonist, have actually been in the market for a couple of years, since 2014. And most recently, they have been studied in a wide variety of populations that have obesity-related complications like osteoarthritis, obstructive sleep apnea, high blood pressure, etc., or history of a heart attack or stroke. And there are exciting times. There's going to be some trials that are going to be published soon, and it's exciting for us to be seeing that evidence and expanding access to these medications in this population. There are right now two main medication classes. There are GLP-1 receptor agonists, and there's also the GIP-GLP-1 receptor agonist. So we'll be kind of digging in after these subsequent questions.
Yeah, no, awesome. So many questions. As weight loss medications continue gaining popularity, how does someone know if they'll be a good candidate for them?
Yes. So these medications have been studied in populations such as people that have a body mass index of 30 or more. You can actually calculate that yourself on a website, plugging in your height and your weight. So if you have tried to lose weight with lifestyle adjustments, that means diet and exercise, and you have failed to lose weight by just making changes on your lifestyle, then you may be eligible to use this agent. Also, people that have a body mass index or a BMI of 27 and more, but they have obesity-related complications already, like high blood pressure, high cholesterol, obstructive sleep apnea, or osteoarthritis, or pre-diabetes, then that might be, you may be eligible to use these agents too before you reach that BMI of 30 or more. Especially if you've already tried lifestyle adjustments in diet and exercise and you haven't been able to lose enough weight.
Yeah. How do the weight loss medications work exactly? Do patients lose weight without other lifestyle changes?
Yeah, so glucagon-like peptide receptor agonist or GLP-1 receptor agonist, they basically work at mimicking a hormone that we naturally produce ourselves in our body. And we usually release it after we have a meal. And it tells our brain, it basically goes to their brain and it tells us, hey, you just ate, stop eating, get ready to digest the food. And so if you have more of that hormone that you're injecting and then you produce your own after you have a meal, then you're going to feel fuller quicker. You're not going to eat the same portions that you used to eat before. And so by reducing that amount of portion on your meals significantly can help you lose weight. It also prepares your body for digestion. So it slows how quickly your stomach moves. And so food is going to sit there for a little bit longer, which is going to make you feel fuller in between your meals too. So it's going to tackle also your cravings.
These have been miracle drugs almost. Tell us about the other uses and positive side effects of weight loss medications. We've heard about diabetes. That's why they were created. What about mental and hormonal health?
Yes. So in terms of mental health, as people start losing weight and they start noticing that their pants are not fitting anymore, like they're too big for them, they get motivated and they go into this upward spiral where they want to do more for their health. So they want to do more lifestyle adjustments to diet and exercise so that they can get the full benefits of the medication. So we definitely have been seeing an improvement on their mental health as they start on the medication and they start seeing the results. In terms of hormonal health, obesity itself causes infertility issues. So as soon as people start losing weight, we see that they become more fertile, and so that they're able to conceive when they in the past have had issues conceiving. I also wanted to touch base on a question that you had asked about, do these medications work even if you don't make lifestyle adjustments? So we do encourage, and these medications have been studied, when you make changes to your lifestyle along with using the medication. We always encourage patients to at least try something that they're able to, um, it's a sustainable change in their lifestyle, whether it's diet at the moment or exercise at the moment. And then as soon as they start losing weight and they're able to do more, incorporate more changes to their lifestyle, as they can and as tolerated. But these medications, you still can see some benefit in weight loss, even if you don't make any changes to exercise. Maybe you're just controlling your portions. But the maximum benefits of these medications are observed when you are using lifestyle adjustments along with the medication. And there are so many benefits to diet and exercise that this medication will never replace. Diet and exercise alone can prevent you from having a heart attack or a stroke. And it's going to also make the medication work even more stronger. You're going to have even more weight loss, because we only can go up on these drugs to the highest dose, right? We can't go infinitely to the to infinite amount of dose. So we always encourage lifestyle adjustments along with this medication.
So many good points. Thank you for bringing that home.
Yeah.
Similarly, what may be some of the signs to look out for to know that the weight loss medications aren't effective for you? Are there problematic side effects that some patients should know about?
Absolutely. So side effects that are problematic with this medication can be nausea and vomiting, right? So this is a medication that is mimicking a hormone that you naturally release after you eat. So it's going to make you feel fuller quicker. So it's going to make you feel like you had a big meal, even though you didn't have it. So you're going to have that nausea. You're going to have that vomiting. You shouldn't have that vomiting. If you do have that vomiting, you should report it to your doctor. But you're going to have nausea, abdominal discomfort. You can have constipation. You can have diarrhea. It's always recommended that you use this medication with medical supervision. And if you have more of the serious side effects, which can be stomach paralysis, and it can be also inflammation of the pancreas, those are reasons for you to stop the medication. And how do you catch it? If you're keeping your doctor's appointments, you're staying up to date with labs, you're reporting anything unusual on you. Those are ways that you can ensure that this medication is being used safely and appropriately with you.
Yeah, and the goal is to have better health. So
Absolutely.
you have to have medical supervision. Why is it essential for weight loss medications to be prescribed and monitored by a healthcare professional? I mean, you mentioned some of the options just now, but there are so many risks involved with unsupervised use. What are some of them?
So these medications are available in multiple doses, right? And they should be titrated to the maximum amount of dose as tolerated not more often than every 4 weeks. So people should be using these medications under medical supervision, being monitored for their weight and their side effects and their tolerance to the medication and their readiness to titrate up to the next available dose if possible, and also monitor their lifestyle adjustments and making sure that they are making adjustments appropriately based on their current status. So I'm blanking on the question. I'm so sorry.
No, I mean, what are the potential dangers of unsupervised use?
Yes, absolutely. So if people start on the medication on the wrong dose, right? On the highest dose or mid-level dose because they want to just get the benefits immediately, that's dangerous. That is where we see the most serious side effects of these medications. So the stomach paralysis and also the pancreatitis. Also, we can see it accidental use because they got these medications without medical supervision, without a prescription, without a consult. They don't have a doctor that's monitoring them. And then they drew out the medication out of a vial that is not FDA approved. And so they're inappropriately dosing themselves accidentally, that still can result in serious side effects of these medications. And we've seen a lot of patients visiting the emergency room because of the stomach paralysis or pancreatitis, which is inflammation of the pancreas.
Yeah. And counterfeit drugs and weight loss scams are the growing concern for so many things you just mentioned. What red flags should patients look out to avoid falling victim to these traps? Because sometimes they may say, it's too expensive at my doctor, I want to go elsewhere, but there are real risks.
Yeah, so they should avoid getting these medications through social media. It's almost always it's going to be a scam. They should be going to their primary care doctor, asking if this medication is appropriate for them, giving them appropriate medical history. What lifestyle adjustments have they tried and failed? For how long? And if the primary care doctor decides that it's appropriate for them to be on the medication, then they will prescribe it, give them a prescription. They will take it to a pharmacy that is registered with the FDA or the state, Florida. For example, we're in Florida right now with the Florida Board of Pharmacy as a pharmacy. And then they are able to get the medication appropriately through a pharmacy that is registered and is going through appropriate compounding practices if it's a compounding pharmacy, or if they're getting it at their local pharmacy through their insurance.
So you said that information is easy to access for everyone.
Yes, we had talked about that. So you can get how do you know if a pharmacy is registered with the FDA? You can go online to the FDA website and look up a 503B compounding pharmacy that's registered with the FDA as an outsourcing facility. There's a list of multi-state pharmacies that are registered with the FDA, and they're basically saying, we are going through compounding practices. We are creating these products safely. It doesn't have any impurities. And what we are giving patients is essentially what they're asking for, right? Whatever GLP-1 product they're wanting to get prescribed. So that's the only way that I recommend that people get their compounded medications through. Yeah. I don't think that they should be getting it at a friend's house, someone drawing it from a vial. I don't think it's appropriate for them to get it overseas from another pharmacy, from Canada or other international pharmacies. I think that the safest way for you to do it is getting it through a 503B registered outsourcing facility for now. And even with that, we run the risks.
Yeah. While compounding is a common practice in pharmacy, what specific risks might arise with compounded weight loss drugs? And how can these patients continue to stay informed?
Yeah. So the risk that we run with using compounded products is impurities. So you can have bacteria, you can have fungus in those compounded products. You can also have some impurities like molecules that shouldn't be there that can cause inflammatory responses or allergic type of reactions to your body, which you don't want. And so those are the risks that you run with using compounded products, especially from a source that might not be credible.
Yeah. Are they becoming more affordable? Because I think that's why people go outside the country. But I feel like I see a lot more information from insurance companies that they're trying to make these more affordable.
Yes. So right now, cash price, there are these products, you can get them at an affordable, and affordable is relative, right? To whoever is out in the public that is affordable for them. Mm-hmm. But you can get these compounded products I've seen for $100 a month, $200, $300 a month, depending on the pharmacies. And for some people, that is affordable without going through insurance. If their insurance covers it, they can have a low copay on it, and it can be affordable. So there are new channels that they are becoming affordable.
Yeah.
Yes.
No, I like to see that. So you said you can either go through your insurance. If it's not affordable, you can go ask, what's the cash price? Mm-hmm. What's the cash price?
Cash price right now? I don't know if I can answer that question, but
no, but I'm saying that there are other options,
yes,
as you mentioned. Anything else you'd like to add? I mean, because obviously you have a lot of expertise in this. You deal with this every day. What are some closing thoughts you would like to give someone watching today that says, I want to see if these weight loss medications work for me?
Yes. So I think the most important thing right now is that obesity science is definitely evolving. we are seeing that people might have just chronic low levels of glucagon-like peptide and their own glucagon-like peptide. And so getting supplemented with products like GLP-1 receptor agonists out there available might help supplement a deficiency that they might just have in their body that's predisposing them to obesity. And so that might be just the push that they need for the weight loss, always in addition to their lifestyle adjustments. And so we might see the landscape of obesity management changing in the next 2 to 3 years. Insurances might not just see this as weight loss as something cosmetic, but something that really prevents their population from having a heart attack or a stroke. Yeah. And so we probably will see expanded access, especially as these trials that are going on right now are going to be published, being studied on all these populations that have obesity-related complications like obstructive sleep. Oops, sorry.
That's okay.
Like obstructive sleep apnea, high blood pressure, pre-diabetes, etc. We're seeing, I think most recently they published like preliminary results that these medications can even delay the progression to diabetes or keep people with having pre-diabetes for a longer period of time before going into diabetes. So I think that these medications are going to be studied extensively in a wide variety of obesity-related complications, and we might see some expanded access.
Yeah, I mean, you've given us so much good information today. I don't even know, I've never had a blood test for GLP-1. I don't even know how to look for that on a blood test.
That's a good question.
So everything, you just blew my mind.
Yeah.
Thank you so much, Doctor, for joining us today and having this conversation. So important as we start the new year, and we're all going to look for a healthier version of ourselves.
It's an honor.
This has been a great conversation. We thank you for sharing your insight once again, Doctor, with our audience. For you guys out there, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from all our experts. Thank you for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.